Bariatric surgery. The reference is taken from the medicine textbook of Dr. Archit Boloor sir. Indications. Bariatric surgery is indicated depending on the body mass index value of the patient. If BMI of the patient lies between 30 to 34.9 kg per meter square with any one comorbid conditions like uncontrolled diabetes mellitus type 2 and metabolic syndrome, then we can go for bariatric surgery. Then if BMI ranges between 35 to 39.9 kg per meter square with at least one serious comorbidity like diabetes mellitus type 2, obstructive sleep apnea, hypertension, hyperlipidemia, asthma, non-alcoholic fatty liver disease, then also we can go for bariatric surgery. If patient's BMI lies beyond 40 kg per meter square or is 40 kg per meter square, then also bariatric surgery is indicated. We know that normal BMI according to World Health Organization is 18.5 to 24.9 kg per meter square, and according to Asian criteria it is 18.5 to 22.9 kg per meter square. If the patient is obese but his BMI is below 34.9, then surgery is not indicated. Then his treatment is based on drug therapy and lifestyle modifications. Contraindications of this surgery are depression, psychosis, bulimia, that is an eating disorder, drug and alcohol abuse, severe cardiac disease, severe coagulopathy. Techniques of bariatric surgery. There are 3 techniques: malabsorptive procedures, restrictive procedures, and restrictive plus malabsorptive procedures. Malabsorptive procedures में स्मॉल इंटेस्टाइन की फंक्शनल लेंथ को रिड्यूस कर दिया जाता है. हम जो फूड इंजेस्ट करते हैं उसका मैक्सिमम एब्जॉर्प्शन स्मॉल इंटेस्टाइन की प्रॉक्सिमल एंड मिडल पार्ट से होता है, दैट इज जेजुनम एंड प्रॉक्सिमल पार्ट ऑफ इलियम. तो इस सर्जरी में दिस सेगमेंट ऑफ इंटेस्टाइन is removed such that it is no more continuous with the stomach and food does no more pass through it. There are 2 methods, duodenal switch and Roux-en-Y gastric bypass. So let us see them one by one. Let us see the steps of duodenal switch, also known as biliopancreatic diversion. तो इसके पहले स्टेप में स्टमक के 75 to 80% पार्ट को, दैट इज मेजर पार्ट को वर्टिकली कट करके रिमूव कर दिया जाता है एंड द रिमेनिंग पार्ट ऑफ द स्टमक इज कन्वर्टेड इनटू अ स्मॉल नैरो ट्यूब लाइक स्ट्रक्चर. सो व्हाट हैपेंस इज, जो भी फूड हम इंजेस्ट कर रहे हैं, इवन अ स्मॉल क्वांटिटी ऑफ फूड रीचिंग इनटू दिस स्टमक कैन डिस्टेंड दिस नैरो ट्यूब एंड गिव अ sensation of fullness and a sensation of satiety. This prevents overeating and thus it prevents obesity. In the second step, pyloric sphincter के just distal में duodenum में कट लगाया जाता है and the duodenum is separated from stomach. In the third step, small intestine के last part से 10 feet ऊपर small intestine में एक और कट लगाया जाता है and this part of small intestine is now separated. Then this section of small intestine is attached to duodenum and this separated part of small intestine is also attached to the main GIT at a distance of 5 feet from the last part of small intestine. This separated part of small intestine is not removed from the body because this is the portion where hepatopancreatic duct is opening and pouring the bile juices and pancreatic enzymes which can flow through it and still enter the intestine, the gut, and help in digestion of food. This was our biliopancreatic diversion or duodenal switch. We'll now see Roux-en-Y gastric bypass surgery. In first step, a dissection is taken into the stomach, into the upper segment of the stomach, dividing it into upper small pouch and lower larger pouch. Secondly, the duodenojejunal junction is cut, and the cut portion of the cut upper end of the jejunum is attached to this small pouch of stomach, and the lower end of the duodenum is attached to the jejunum at a lower point. So if we look at it, a Y shape is formed in our GIT. This is the reason why this surgical method is known as Roux-en-Y gastric bypass, and this is the most commonly used method of bariatric surgery. The second technique is restrictive procedures, wherein adjustable gastric banding, sleeve gastroplasty, and vertical banded gastroplasty are done. Adjustable gastric banding. A band is taken and is applied in the upper segment of the stomach, producing a small upper pouch and a large lower pouch. So two things are happening. The lumen is narrowed between the upper segment and lower segment of the stomach, and a small pouch is produced. So whatever food we are ingesting coming through the esophagus first enters this small pouch, and the small quantity can distend this small pouch easily, giving a sensation of fullness, giving a sensation of satiety, and preventing overeating and preventing obesity. Now this lumen is narrowed, so small quantity of food can now enter the further part of GIT, and small quantity of food is entering, so there is less digestion and absorption of less nutrients. Also, this band contains an inflammable balloon which is connected to a tube, and the other end of the tube is connected to a pot. This pot is kept attached beneath the skin of abdomen. Using a syringe, air can be infused through the pot into the balloon, and the balloon can be inflated, narrowing the lumen further. So depending on the condition and need of the patient, this band can be tightened or can be loosened. Third technique is restrictive plus malabsorptive procedure, which includes intragastric ballooning and duodenal switch and Roux-en-Y gastric bypass. We will now see complications of bariatric surgery. There could be complications during the procedure, and there could be complications post-operative. During the procedure, hemorrhage, infection, and gastrointestinal leaks are common. Post-operative, bowel obstruction, malnutrition, that is decreased absorption, dumping syndrome, hernia, gallstones, and gastroesophageal reflux disease are common. What is dumping syndrome? As we saw in Roux-en-Y gastric bypass surgery, the stomach along with duodenum and along with the pyloric sphincter is taken away from the continuous GIT. So now whatever food we eat, it remains in the stomach for a very short duration because there is no sphincter between the stomach and the intestine. So the food directly comes into the intestine undigested. This is known as dumping of food from stomach to intestine, and this is called dumping syndrome. It presents with clinical features like flatulence, feeling of bloating, nausea, vomiting, and diarrhea. So this was all about bariatric surgery. Thank you. Please like and subscribe my channel.